Good morning, everyone, and happy Thursday. Thanks for being with us today for our scheduled Executive Director, Program Director, Stakeholder meeting. This is Sarathel Burgess-Burnett, Deputy Commissioner here at Children's Services Division, and Tiffany will be in to join me in just a moment. We are having technical difficulties on our side. I just want to make sure that we're able to be heard and that there are no technical issues. Again, if you have any questions, you can always put those questions, as you know, in the chat box. So welcome, and we're glad that you are here with us this morning. Next slide, Tom. Go forward. So again, housekeeping, just reminding everyone that everyone's on mute. There will be a point like we did before where we will ask individuals to share and update us on how things are going out in the field. Many more sites have opened, and just we want to hear from you how things are going out there. And we will go through the slides first, and then we'll give you an opportunity to give us some updates and let us know how you're doing. And so again, if you have any questions, please submit those in the chat box. Next slide. So the agenda today, we're again, as always, we're giving you the COVID update. We do want to go back over delegate responsibilities, and it is that time of year where the universal application has launched, or the application for preschool 3-4-year-olds has launched, and it is closing, and we will be doing placements July 15th. So we will be going over some of the work that needs to be done in order to make sure that you're able to get the children from the families that have identified your sites as the location that they want their 3- and 4-year-old for the fall. We're going to talk about reporting positive COVID-19. Again, funding flexibility, the update that we have from Head Start. Then we'll do some announcements. But again, I just want to make sure we do have quite a bit that we're going to go over this morning. So again, we're really happy you're here. And Tiffany has joined. Again, I've already mentioned that we're having technical difficulties on our side. And so we're actually in a different space and not where we would normally be when we would do our webinar. So we're hoping everything goes forward and that we don't have any technical issues. Next slide. And so again, the death rates is, you know, as we see, we've in Illinois, we've gone above the 7,000 rate. We never wanted to get there, but we are. But we have tested over 1 million, almost 2 million individuals as of yesterday, or as of the 7th, excuse me, which is great that we've been able to get the number of tests up in the city of Chicago, and particularly sites that have opened in some of the hardest hit communities, so that individuals have access to testing. We're really happy to see that people are actually following through and getting those tests done. Having had it done, it is not the easiest thing in the world to do, but I'm really happy that people are doing that, and people are doing everything that they can here in Illinois to keep our numbers down. And I know all of you out there are doing everything you can within your programs to do the exact same thing. So we thank you for that. Next slide. So as of today, and I have not checked the data today to see if any additional sites open. So I will say this was yesterday. We had 184 of our sites that had opened and were serving children center-based. We also know that children and families are still being served remotely, but we had 184 doors opened, which was great. We know that people are coming online. As we know, we've talked about the staggered reopening, and so we do have agencies that will open later this month, and we do have some that will open in August as well. So we're moving forward, getting the doors open, but in doing that, we also want to keep our doors open. So we're going to talk a little bit more about some of that. I will say that when we first started, as expected, with the number of children that have been home, you did your job, you did your work to try to get parents to come back. So we are seeing that classroom attendance numbers are climbing as well. When we first opened, we were under 100 children. We are up over 2,000, and today I'm sure there are even more. But again, the families are coming back into classrooms and being served, which is what we want them to do, because we know the best thing for young children is to be in our educational environment. So I thank you for all of the work that you're doing. Continue to serve your families that are not in your center-based classrooms via remote learning, because those children are still counted as your enrollment numbers. As I said in our last EDPD, Our enrollment was static as of the close of all of our sites in March when the governor closed child care centers in the state of Illinois. We then turned that enrollment number over to our funders, and we're working with those numbers. And so when you're thinking about the number of children that you have center-based, you also need to be thinking about the number of families that you're still serving remotely. And we're going to talk a little bit more about how we can capture some of that data a little bit later in the slides. Next slide. So again, as I just mentioned, we're still doing staggered reopening. We understand the reason and the rationale behind that. It's the agency preparedness and your ability to do it, meaning that you have staff available, because we know, just as we're talking about children, we're talking about staff, we're talking about families, we're thinking about their ability and readiness to come back. So we do understand all of what's happening in the community and why we're staggering the opening. Community impact is one of the other reasons that we said to our funders that we will be staggering our reopening, because we had some very hard-hit communities in Chicago, and we needed to respect that. We needed to make sure that you were able to do what you needed to do on your side of working with your children, families, and staff in order to open safely. And so I just want to pause for a second and say thank you for everything that you're doing to make this the safest opening that we possibly could in Chicago. We understood the need for staff availability, and we do understand that there are fears on the side of staff in coming back. They resonate the same messages to you, I'm sure, as your families do. And again, as I said before, with the staff response and the family response, it really is making sure that they all understand what it is that you're doing within your program and in your site to make sure that this site is as safe as possible for all concerned, and allay some of those fears on their behalf so that they will feel the comfort in coming back and understanding that you've already thought through what you could do and what's needed. And so we thank you for that. Next slide.
Hey, Rachel, this is Tom on the technical assistance side. Can people if they can hear, can they type in the chat box that they can hear right now? Because sometimes people have
yes,
on their computer end that they can't hear.
Yeah, I'm seeing it come in, Tom. Thank you. And they're saying I can hear.
Okay.
Yes.
So it's just to let people know they probably can't hear me if they don't have audio, but sometimes it's the computers that are on the person's end. And so we apologize for that, but the best way to listen in is to always use your telephone, and you have that option once you join the webinar to use in your dashboard to switch it from computer audio to your phone audio. Thank you.
Thanks, Tom. Next slide, please. So this is a repeat slide from before, and it talks about delegates must complete your reopening plan and sending those to DCFS and to DFSS. If we have not received them, I ask and encourage you to do so. This is a part of the documentation that we have to have for sites that are open in community, so that we have the information that you put together on your health and safety plans and measures that you put in place and in your programmatic structures. And so please, if you have not, please submit those. Delegates who have partners under them, we need to make sure that we have those as well as documentation that there is a safety plan in place for children being served. You must determine, again, the date that you're going to reopen. If you've not shared your reopen date with us, we need to know what date you're planning to reopen. If the date changes and there's something that complicates it, you can come back to us and change the date. But we do need a reopen date for all of our sites. So anyone who has not given that to your supervisor of your team or sent it to me or Tiffany, please do so that we can have the expectation going across the next couple of months of when children will be served in center-based care, because this is documentation and information that we're sharing also with our funders. We need the ages that you're serving, the group sizes, the number of staff in each of those, so that we can document into our files and in our report the number of children is being served, because we have the multiple funding streams from 0 to 5, and we need to know how many children you're having in each of those groups. Reminder that 8 infants and toddlers, and also the 10 in the group size for 3 to 5. And I will pause for a second because I do know that there's information out there that talks about 15. We started off with 10 and we have stayed with 10 and said that we would then engage and increase those numbers as we go forward. Staying that course to make sure that we're able to have safe reopenings, giving you a chance to get all of your staff back and all of your families back into your programs. You have to determine what plan you're implementing for children and families is not center-based. We need to know how many of those children are being connected to remotely so that we can then look at your enrollment number, again, the stagnant number we had in March, to ensure that all of those families are still being served, and that's what we're attempting to do on our side. So we need both the number of children that you're serving center-based and also the number that you're planning to serve remote or are serving remote for those of you who have opened. Next slide. So we are in the process, and I just mentioned that we're trying to make some changes, and we are doing a COPA enhancement. We're in the process of working to allow you to enter temperature checks and also record children that are receiving services remotely so that you have a place where that information will be captured. It's been opened in COPA. We are looking at it here at DFSS, and then we will be sending out a training module to make sure that everybody understands how to access it, how to use it, and the information that can be put into it. And so you will be getting information very soon about this enhancement that will allow you to, in COPA, say what your temperature checks are. And so if a child arrives and the temperature check is below the 100.4, you can put that in, that child is fine. If you have a child or a family that arrives and the temperature is above that, you can document that. That's your documentation and your rationale for not accepting that person into your program for that day, and then talking to them about what they need to do medically to ensure that they are safe to return back to your site. And so more to come on this enhancement. Once it's open, you're going to get the information. I wanted you to know it so that you will be looking out for it. Your staff that are doing this work will have access to this system and be able to put this information directly into COPA on your behalf. Next slide.
All right, so this is Tiffany Junkins. I wanted to talk about COPA placement preparedness. So next week, we're going to actually begin placement. In order to do that, I want to make sure that all of our programs are prepared for placement. So there's a few things that I need our programs to be able to do. One of the first things I need you to do is to identify which currently enrolled children will be returning, because they need to be flagged in COPA as such. Okay, so that's the first thing that needs to happen. If you're not the person who's actually doing this, please work with the staff person who is designated to actually do this for each one of your sites in the COPA system. So the first thing is flagging those returning children. The second thing that needs to happen is that you're opening the next year's slot matrix in the admin portal. And then you're going to enter the number of seats in each classroom. This is going to be important because it is going to be the number of seats minus the number of returning children that will determine how many offers the system can make. So you have to do items 1 and 2 first, and then that's going to determine how many available seats there are. So you're going to set up your slots on the matrix. You're going to move your slots from bucket 5 to any of your lower need buckets as applicable. And that's going to be different according to each center. You guys make that determination. But the lower buckets, anything less than bucket 5, is going to be the more needier families. And that's why we're saying this. If these steps are not realized in COPA, then no offers will be made, as applicants will be notified that your site is waiting, and it'll say waiting site full. We don't want that to happen to you, where families want to get into your program for the next school year and they're not able to do that because you haven't set up your slot matrix, according to make it available to make those offers. So we do need your help in communicating this within your organization, and we need this to happen as soon as possible, as placements do start next week on July 15th. So all of this has to occur before then, in order for you to have a successful placement process. If you need any additional help, of course, my team is here. We're available. You can contact myself. You can contact Victor Santiago. You can contact Craig or Jennifer. Please reach out to us. Let us know if you need any help. Thank you.
Next slide. And so and this slide was there before, just want to make sure that you have it again. The DCFS did put out a new emergency rule for reopening childcare, and it said that it was, again, this licensing rule is in effect for a maximum of 150 days. I do that so that you can be reminded. It came out June 24th, and so it's going to go through into the fall, and there will be an additional one that will come out after that. What they're doing is keeping their eye and pulse on what's happening nationally and also statewide as they're determining what rules, if any, need to be changed within early learning and child care centers. And so just know that this one has a maximum days of 150. Please keep your eye out there so that you'll know when the next iteration comes out and if there's any changes to the licensing rule. We just don't want this one to fall off your radar. We know things are constantly changing through this process. COVID-19 has us all doing things over and over, changing, editing, moving, and I know you're having to do it on your side as well. But there's a policy shifts and policy changes out there, and in this particular case, a licensing rule. So I just want to make sure that you're aware of this. Keep it on your radar. Your staff that are responsible for pulling down licensing standards and updating your agency, make sure that they have this one, and also please make sure that they get the next one, which will come out. This one again is due to come out again after the 150 days, unless they decide that what they have in place is valid, then it will carry over. But we don't know that, and we won't know that until we get further into the fall as far as what's happening with COVID-19 in the state of Illinois. Next slide. So reporting positive cases, and I do have to say that we have had some positive cases in some of our sites that have reopened. One site, a staff member came in to clean a facility before the site actually opened. But we've also had a couple of staff who've been on site in classrooms with children and families who became ill, were tested, and did have positive cases. We understand the seriousness of that. We understand how that strikes fear in everyone. But we know that we're not past COVID-19 in Illinois, and we're definitely not past COVID-19 in Chicago. And so we expect, and we don't want, but we do expect, as people are tested, there will be more positives. But we have to know when you have those cases. And so you are responsible for reporting any positive 19 case. You have to report any case where the individual entered your facility, worked at your facility, as a child in your facility, staff. You have to report that. And you have to report if a staff member or child has come in contact with a person who's had a positive test as well. This is the only way to keep accounting of who's come in contact with someone and where the impact may be greater than just that one individual. And we just want everybody to, within your programs, to continue to ensure that we're doing this. You have to report to DCFS because that's your licensing rep. You also need to be reporting Chicago Department of Public Health, and then you also need to be reporting to DFSS. And so there's 3 reporting structures that you need to go through to make sure that we know what's going on. You'll get guidance from your representative. You'll get guidance from CDPH. They'll ask you more questions. They'll want to know from you where, the who, how many people were in contact with that individual so that they can keep an accounting of it. Excuse me.
Yeah, so they can definitely keep an accounting of it, and contact tracing in this world right now is important, right? We have to be able to trace it back. And so as Sarita was saying, you know, if they came into contact, there's going to be a lot of questions around who, when, where did it happen, right? And we have to be prepared to answer those types of questions. I know before Sarita has talked about making sure that we're consistent with our groups and not moving staff around and things like that. That's the reason why. We want to make sure with consistency that we're able to go ahead and narrow down and really mitigate any risks to others. And so we do that by making sure that we can maintain the same groups.
Thanks for chiming in, Tiffany. I apologize for that. And again, to Tiffany's point, this is all about mitigating risk and keeping the numbers down. What we don't want to do is close an entire building or close for a longer period of time. And when you're able to report and you can mitigate, saying one staff member was in a group with 6 children, for example, the impact is that staff member and those 6 children. If there's another staff member in that classroom, then you've got 2 staff, 6 children. But if you're not able to account for it that way, then it appears that we need to mitigate risk by talking about the entire facility. So staying with your group sizes, structure it where teachers are staying with the same children throughout the day, making sure that when children are moving from one place to another, that they're moving in groups together, that their activities are together, that they're not mingling in your child play spaces, on your playgrounds. To mitigate risk, again, and we talked about it, is keeping your classrooms and your groups separate so that we are able to not have any risk. Tom, I'm seeing in the chat box that the audio went out. Could you check that for me, please? Thanks, Farah. And other people are saying that they can hear, so I'm going to go ahead and continue. Tom, if you're hearing me, please, next slide.
Yes, I can hear you. Sorry, the audio is usually on the users and if they're using the computer, but people are saying that they can hear.
Absolutely.
I'll go to the next slide.
Thank you. And so in reporting, delegates, you have to report positive COVID-19 results. You have to tell your parents that this has occurred so that they're aware of what has happened, so that they then know what they need to do for themselves and for their children. You have to let your staff know. DFSS, DCFS, and CDPH, as I mentioned before. We talked about making sure your policies and procedures, your family and parent handbooks were updated, so everyone understands and knows what happens in the instance of a positive COVID-19, that you will make the decision, you will tell them what the next steps are so that they are informed. You must report if a classroom or site will close. This is information that you're giving as you're talking about and getting guidance from CDPH or DCFS. When you're reporting, let us know if they're saying you need to close a site. Are they saying you need to close a classroom? Are they saying what you need to do for staff, children, and parents? We need to have that in our report that we're capturing on each of those that we're getting the information. What I have done is I've gone back to supervisors who received reports and asked for other information. And so I'm saying this to this group today and asking that when you report, that you give us all of that information. And if you're still waiting on guidance, meaning DCFS and CDPH has not responded, let us know that, hey, they have not responded and given you the guidance, but then let us know as soon as you get the guidance so that we can update our report, letting us know whether or not you're going to be able to close a classroom, close a site, and what guidance have you received. You must follow the guidance and direction that they're giving you. If they're asking you to close a classroom, you have to close that classroom. If they're asking you to close a site, you have to do that, and you have to do it for the number of days instructed. And I know this is a hard one, and people don't necessarily want to do it. Talk them through. When you can talk about how you've mitigated risk, how you kept the group small, how you kept the teachers in one place, how you've ensured that you've had minimized risk of transference in your center, they can work with you on that guidance. Again, that's why we're saying, again, repeating and responding and saying it again, please keep your groups in the same place for the entire time with the same teachers. If you're going to the playground, they go with those same teachers. If they are going to any other place in your space, that they're going to that space in a group. Not only are you doing that, but you're doing your cleaning before and you're doing your cleaning after. So no other group comes in contact with what's been touched by the group before. Just giving you the reminders. I know you're doing it. I know you're doing a great job out there, but we do have a responsibility of constantly reminding as we go through COVID-19.
And I just wanted to add too about making sure that we're protecting people's privacy, right? That's children and staff. It's very important, and I know, in this critical time, everybody is curious about, why is somebody out, or who is the person who was infected and that sort of thing. We have to make sure that we're keeping people's privacy, first and foremost, that we're not putting it out there, right? And we're really respecting those HIPAA laws. That's going to be important as you move forward. Even if it's that we have to announce which classroom, maybe it was Busy Bee's classroom, we're not being specific about who the teacher is, that's going to be important, or who the student is. And so I just want to make sure that as we're going about our, our business, that we're also protecting people's privacy in this.
Thanks, Tiffany. Next slide. So again, enhancing your procedures and making sure that you're doing everything you can to keep your programs clean, all your high touch areas, your doorknobs, any toys that you can clean. You should not be using toys that cannot be cleaned and sanitized, which means all your soft toys and everything needs to be out of your environment. If you're using keyboards or computers in your classrooms, you've got to make sure that you're cleaning them in between the use of one child and the next child. And so again, I understand that, it's a lot of cleaning, and a lot of cleaning, but that's necessary to mitigate risk. And again, PPE, staff are required to wear your mask. Children over 2 years of age are required. And when they're traveling between spaces, in the hall, et cetera, they need to have their masks on. So that, again, this is about mitigating risk, and we're trying to keep it at a minimum. What we like to do is have no more positive cases in any of our programs. I do understand that that's a high hope, especially now, but we do want to mitigate risk as much as we possibly can within our facilities. Next slide. And so we gave you some information and updates before. July 15th is the day for the trauma-informed care. It is an online training. And so the link, if not out, will be out so that your staff are able to sign on. We want as many people as can to participate in that online training. And again, I mentioned earlier, please, if you have not updated your parent handbooks and policies and procedures and given those out to your families and to your staff, please do so. They need to understand what this means and what your responses are and why you're doing everything that you're doing. I would believe in most cases, and 100% of you have already done it, but I would just want to make sure that that reminder is out there. The next webinar will be July 23rd. We're still going to do them every couple of weeks, allowing us to ensure that we keep up with what's going on out in community. Our staff are still not able to come out and visit your sites. We all want to see children. Believe me, we all miss all of you. But until we get further into what's going on in Chicago and at a point where having individuals who have not been in your spaces, we're not sending our staff into your spaces. Our staff are working remote. They're teleworking, and they are available. So you can reach the staff as needed. We're all available. They have their computers. They have their laptops. They are accessible, can respond, and I know they have been responsive. And we'll continue to do so in our support of you as we go through this. So again, just thank you for everything that you're doing. Again, having 184 doors opened out there is great. Having a small number of incidents and programs, we're really happy to see that it's been very minimal. And we're hoping to stay the course and continue to be able to operate that way going forward. Next slide. So we do have children's masks here at DFSS. I mentioned it before, and we do have them here. Our plan before was to have them distributed at United Center, but because of the number of delegates that we have and the complexity of our program, they weren't able to do the distribution at United Center. So I have all of the masks here at our site at 1615. I have staff right now working to package them based on your enrollment so that we can let you know when we will be able to distribute. Right now, tentatively, we're saying Friday. You will get an email letting you know when and where and how to pick up. What we're planning is a grab and go, meaning that we will already have packaged the number of masks either in a box or in the bags for you. And what we'll be doing is having you have your staff literally drive in, pick up, and drive out so that they're able to pick up and go. Again, our job through this is to minimize our risk and to minimize yours. And so what we don't want is to come into buildings, sit for a long time, and do all of that. And so we're trying to plan for a grab and go. And so we'll send you the information via email letting you know how we will accomplish the grab and go here at 1615 at DFSS's site. But we do have child masks for you, and we do want to get them out into your hands as quickly as we can, and we're planning to do that right now.
And I just wanted to make sure that everybody knows that we put a survey in the CSD update. And so for those who responded to the survey, those are who we're going to be contacting. So if you have not completed the survey, then I don't want you to be alarmed, but these were donations, and we had to be able to provide the person who actually did the donation with the list very quickly. And so if you missed that opportunity, hopefully we'll have others, but this first round will go to those who responded in the survey last week.
Next slide. So I just want to give you an update. We have received an update from the Office of Head Start. We had a funding flexibility that provided the flexibility for you to continue to pay staff salaries and benefits through June 30th. We have received an update, and it has now been extended through September 2020. We know, and again, that's why your ability to do children remote and center-based as a combination is because Head Start is understanding what's going on and what's needed for children and families and trying to keep everyone safe, and they're working with us, and we thank them for extending the funding flexibility to September of 2020. But you must continue to update us as you increase your classroom capacities. We know that you will, those of you who opened early June, will be able to sometime in July increase your numbers center-based, and we need to keep an accounting of those updates. And so we will be coming back to you constantly asking for updates on class size, group size, updates on your information so that we can keep an accounting of it. That information goes directly to Head Start so that they can see how many children are being served here in Chicago. And again, you've got to continue to serve and document children that are receiving services remote. They are still enrolled under you. These are still your children. They're still accountable. And so if they're center-based, that's fine. If you're serving them remotely, that's also fine. We just need to have an accounting for both as we're going forward so that our numbers are clear on how many children are being touched by you through this process and through this period. Next slide. And so I'm going to let Tiffany talk you through the CARES Act funding that we've also received.
So we're really excited.
Or receiving, let me say.
Yes,
receiving.
We will receive. So we're really excited, right? The Office of Head Start has put out an information memorandum in support of the CARES Act, and there's $750 million under the Head Start Act that will be provided to programs across the nation. So Chicago plans to receive $11.1 million, and we've applied for the funding. We don't have the funding yet, but we have applied for it. And our plan on how those funds will be spent is as follows. So we plan on increasing mental health services and supports through our crisis response and intervention services. We plan to drop ship educational kits to help your programs in support of remote learning efforts. We know that there's been a lot of e-learning or remote learning, and we really want to make sure that we're helping those efforts. So we're working with our partners at Lake Shore to go ahead and get kits sent out to you for our center-based programs as well as our home-based programs. And so we're expecting those to be shipped by the end of July, beginning of August, but you will get more information on that. We're also procuring a SurveyMonkey enterprise account because we need to make sure that we're increasing our ability to gather data in real time from our delegates. And so that's going to be pivotal for us to have our own SurveyMonkey account. And I know you probably are thinking, hey, but we received surveys from you guys before. We've had a shared account for a number of years across 8 divisions. And so now Children's Services will be getting their own SurveyMonkey enterprise account, and I'm super excited about that. And then we're going to also be implementing an analytic data warehouse using our early learning data to support our rapid response to COVID-19. So really excited about the improvements that we're making in terms of being able to analyze our data and develop this data warehouse. So more to come on that. So that's what the grantee is planning to do with the grantee portion. But the good news is on the next slide. So we understand that we need to put money in the hands of our delegates, that you guys need support regarding COVID-19 related expenses. And so we're going to be looking to help you by increasing delegate contracts. And this is to, it has to be COVID related. These are one-time supplemental funds in our fight against COVID-19. And so things like PPE, masks, face shields, the increased cost that we're having to go ahead and spend on gloves, hand soap, hand sanitizer, disinfectant, bleach, contactless pediatric thermometers, computing devices, laptop, Chromebooks, Wi-Fi capabilities. There is a big digital divide, and when we had to go to remote learning, this was quite evident that we had some families who were at a disadvantage. And so if programs are purchasing technology and they need to provide loaners to families during times of remote learning, we want you to be able to have that ability to be able to be responsive to your family's needs. And so those are going to be allowable expenses. Safety signage. We understand that, having signage, reminding people what their responsibility is regarding social distancing, 6 feet markers maybe on the floor, or, signs that say, hey, you can't get in here without a mask, no shoes, no shirt, no mask, no service, sort of thing. But whatever that safety message is, as long as it's tied to your response to COVID-19, those safety signage will be allowable costs. Enhanced cleaning, deep cleaning, and sanitizing a facility. Those costs also can be considered. This is not an all-inclusive list. So if you have other things that you're saying, hey, we need to go ahead and spend money on, as long as it's COVID-19 related, what I'm going to ask for you to do is definitely make sure that you're sharing that with our team, because I'm interested in knowing what other areas that we can help to support. But these are some of the things on the surface that we recognize, and we want to make sure that you understand that there will be funding allocated to you to increase your contracts to help in this fight. I'm asking all of you to talk to your accounting department so that expenses that are COVID related can be separated. That's going to be critical. We're going to be working with our finance division to go ahead and create a budget that is going to allow you to go ahead and track those things separately. And so where we traditionally have a supply line for you, there will be a supply line for CARES Act funding, okay? And so we want you to make sure that you are charging, COVID-19 related expenses to the CARES Act funding that you will be provided for all of our Head Start programs. Next slide. So this is what you can expect to receive in terms of a cost per slot. So this is going to be based on your funded enrollment. You don't have to worry about writing this down quickly, as this information will go out to you, but we wanted you to get an idea so that you can be planful about the money that is coming your way. The amount of children that you have in your program. As a matter of fact, yesterday in our CSD update, we even published these rates in our CSD update. So make sure that you're taking a look at that, making sure that you're also sharing this information with your accounting department so that they can be planful as you start to go across the duration of your program year. Just to let you know, these funds are going to be good, and we can reach back to expenses. And they're going to be good through November 30th, okay? And so I want you to, to be planful with the money that you're going to be given. And again, COVID-related expenses only. We can't approve anything outside of that, COVID-related. Next slide. All right, so City of Chicago's emergency travel order. So wanted to make sure that we spent some time to discuss with you the travel ban, because this is important, right? As we have programs, this is summertime, and sometimes people like to go ahead and vacation on summer. We have some states, and I want you to go to the city's website to see what those states are, where we're saying if you live in the City of Chicago and you work in the City of Chicago, you have to respect this travel ban. This is going to be important for you to talk to your human resources departments about. Not only that, making sure that you're talking to your employees, because this is going to have an impact on their lives as well. The bottom line is, if you're going to a state that has been included on this travel ban, and I think right now there's 15 states, So if you're going to a state and you're going to be there over 24 hours, the idea is that potentially there's going to be a risk there, right? And if you're coming back to Chicago, then you have to quarantine for at least 14 days. And if you are found to not abide by this emergency travel order, that you can be fined up to $7,000. I want to make sure that everybody is aware of that. I want to make sure within your organizations that you're talking about that. We don't want to be silent on this issue because I wouldn't want anybody to be caught by surprise when it comes to what their responsibility is. And I think more so than the fine itself, it's really about making sure that we're keeping people safe. We want to keep our children's, families, and staff safe.
And so again, as we talk about mitigating risk in your facilities, and to Tiffany's point, it is vacation time and people are traveling. They need to understand that there is a travel ban in your facilities to mitigate risk. They need to understand that if they've traveled to these places there for more than 24 hours, them coming back in your facility is definitely an issue for you and your families, and you have to decide what do you do regarding that staff. So I would say get ahead of it and make sure that everyone understands the travel ban, that they will be required to quarantine for 14 days upon return to Chicago. And what would that mean if it's a staff at your facility? Again, I want to respect the fact that people want to vacation. It is that time of year, but we also understand that there are things going on that we have to carefully moderate, and we do have to know where people are traveling to and when they're coming back. And if they come in contact within a hotspot in our nation, what might that mean for your facility? So again, go to the website, see the states, understand what it is, talk to your HR people about how you can have this conversation with your staff, but make sure that you stay on top of it. Again, because what we don't want to do is have anyone come back and then you have positive cases in your facility, knowing that we had this information, that we also had a travel order related to that has come to us from our health department. So again, just be very, very careful and have conversations with your staff. Next slide. So next slide. So what we want to do is we want to open up the discussion, and I know that there's some questions, so I'm going to start with questions first and try to answer some of those. But just like we did before, we want to open it up and have some questions and answers and just talk about how things are going. So Tom, if you can let us see the questions.
On your end, on your dashboard, you have a question panel, and next to the X is a little box with an arrow pointing to the top left. Can you click on that?
It's not working.
Can I? All right. If people can stand by for just 1 minute, we'll make sure I get it working. Just 1 second, please.
We're taking a brief intermission, guys.
Okay, Tom, I've got it.
There we go.
Tom, I've got it. So I've got the first question I'm going to respond to. Am I saying that after 4 weeks that you cannot increase? No, I'm not saying that you cannot. What I'm saying is that if everything goes fine and you're able to go through the 4 weeks and be responsive, have mitigated all the risk within your facility, and your licensing rep says you're ready to go to the next level, then you'll be increasing your children and your group size. And so it's after the 4 weeks. Yes, that's what the plan is. It's still the same plan. Is to move forward and increase the number of children in care. But at the same time, for example, if you had 17 in that same group, when you get to 15, you still have 2 children that are not being served in that group. They still should be served remotely. And so we just want to continue to make sure we're offering services to every one of the children and families. Linda is saying that in putting the temperature checks into COPA is a requirement. When we send out the guidance, we will respond to whether or not it is a requirement. We want you to have a tool that allows you to capture this information, and one that you can go to quickly and identify any of the children that have been sent home and any child who during the day, if the temperature goes up, we want to make sure that you have that. Some people have access, some people don't. What we're trying to do is make sure across Chicago that people have access to these kinds of tools and can do that. If you have your own separate screener, it's fine to have your screener. This just gives you a data system where you can also put that information in. And in that same tool, you'll be able to talk about and identify the children that you're serving remotely. So you're going to go into it anyway. We're just making sure that you know it will be available to you, and we'll send guidance and instructions on how to use it.
Absolutely. And one of the things Sariko and I we were talking about was just about how this really can help with your liability, right? So if you're doing temperature checks upon entry of your facility, and the child's temperature was not above 100.4, that really helps you, if later on that day, right, it changes, the circumstances changes. When you allow that particular child or individual to come in your facility, they were fine. You have it recorded that they were fine and they were within what the standard is to be admitted. But if that changes, that is something that can be noted as well. So just thinking about your liability, I think that it could very well wind up being, a recommendation from us or a best practice for us, but let's think about how we can keep our families and children safe.
Linda has another question, and it is, would URSEA monitors be helpful with the slot matrix, or should we go straight to you? Right now, as Tiffany mentioned, as far as help for the slot matrix, she mentioned Jennifer, she mentioned Craig, she mentioned Victor as your starting points for that, so that they can give you the assistance that you need in setting up your slot matrix in the COPA system. So I'm asking that you go to those individuals first to get guidance and assistance. Constance, I want to understand your question. You might have to help me with it. Is this the same procedure for standalone home visiting programs? I'm not sure if that question is related to, so if you can respond and let me know exactly what that question is in relationship to, I'm going to go ahead and scroll through and answer some others and then try to come back to that one. Right now, Tracy's question is about going forward and continuing to serve children remote because their Head Start slots were 20 in the classroom. We're going to continue this guidance as long as we are where we are and we're getting guidance on keeping group sizes down. Right now, I don't see any movement in any document or anything that takes it above 15 right now. And so working with HHS, we're continuing through. They've given us now the flexibility to go through September. With our flexibility and paying, because they recognize that right now we're not moving forward into group sizes of 20. And so for now, we're still staying at the 15 at most. And when you get to that 15 and then 5 additional children would be served remotely would be our expectation until things change in our nation, until we get guidance otherwise, as far as increasing the number of children in your group sizes. And right now, we don't have anything on the horizon that's taking us above 15. And Farah says that they're thinking about using face shields instead of masks. And again, we do have agencies that have decided to do face shields. And what we want is for you to have whatever that shield that you're using in your classrooms and for your staff, be it masks or face shields or both, is what we're saying. And so as you're getting the dollars, if for Head Start dollars, those who are funded through Head Start, when you get those dollars and you have not bought face shields and you want them, you will have resources that will allow you to do that. We're finding that many of our sites have gone to using face shields, and that's absolutely appropriate for adults, while the children then have the masks in the classroom and when they're transporting down halls and other places as described earlier. And again, Cindy Law is bringing up the question about children who are English language learners, and also not only children who are English language learners, children with hearing deficits also read lips, which becomes very, very difficult with masks. And that's why face shields incorporated into classrooms in some cases is a better usage, because then children are able to see the faces of their teachers. And so again, we started off with the guidance that we had, which was masks. But we understand that people have purchased and have face shields. We also, if you looked at what Tiffany wrote, it said face shields. What we're saying is face shields are appropriate, and yes, they can work in your classrooms.
And we've seen some pretty cool masks as well. There's some companies out there who are making masks that are also clear around the mouth portion, understanding that we're serving, you know, different types of children and abilities and learning abilities. And so, absolutely. I mean, we want to go ahead and take all those things into consideration. You know your families, you know your children, and we expect for you to go ahead and make sure that you're meeting their needs.
And I think the question from Tracy is, can we go pick them up, meaning the children's masks? And yes, people will be picking them up, but we'll be letting you know when, because we're going to have to time this to make sure that we can do a grab and go. And so once we have everything packaged and we are able to go down the list, we're going to actually send emails and let people know exactly when to come to 1615 so that we can do the grab and go. But we've got to work out and construct this for our building as well so that you can come in and come out. We do have an operating library on the first floor. And so I know that they have people who are coming in and out picking up resources. And so I just have to carefully moderate how we come in and how we go out. But we're going to try to make this as accessible as we can and keeping everybody safe. Scott's question is 184 sites out of how many? We have 308 sites, but that also includes our home-based programs. So we're at about 60% open, but in terms of center-based programs, I think we only have about 200 and something. I have to get that number of how many center-based operations. So, but we have 308 sites, but that includes home-based operations, family childcare homes as well. Zuli's question is, these are not disposable masks, these are cloth masks. Again, even cloth masks have a life on them. They're not forever masks. And so they are cloth masks, they're not disposable that you're receiving. I don't know what BD is, Zuli. You will need to let me know what that is so that I can respond to that. But as far as the masks, they're not disposable, they are cloth. Is there any additional COVID-related funding for PI-PFA? We're working on trying to make sure. We do know that within many of our sites there's blended funding, and we just looked at enrollment in those classrooms. But as far as having state block dollars that allow us to do the exact same thing, we don't have those dollars. These are CARES Act dollars that came from the federal government that we're resourcing programs for right now. But we're looking for additional resources and trying to see what else we might be able to do for additional programs. The CARES funding is Head Start and Early Head Start Child Care Partnership, and Early Head Start expansion. Yes, those are the dollars that the CARES Act funding is supporting. Home visiting programs, if they are Head Start, Early Head Start. Home visiting programs, yes, they are. The kits are going to those as well. We've included those in the numbers of the kits that we purchased.
Yeah, and just so everybody knows, the educational kits, they're going to go to your programs, whether it's Head Start or non-Head Start programs. So we've made an allowance to make sure that every 0 to 5 child actually will be receiving the educational kits.
Zuli is saying we have already purchased learning kits. Can we please have the money? We don't need 2 sets. The sets, what we're doing, and we can talk Zuli offline, what we were purchasing were kits that are going for directly to your parents. So let's talk about what that is, because parents need supplies and activities in home, because we see them being at home with some of their children for a longer period of time and supporting early learning within the home. COVID-19 dollars cannot be used for soft or plush toys because soft and plush toys should not be used in classrooms right now, because these are not things that you can clean easily between children's usage. And so just by the virtue of the soft plush toys, some of the different equipment and furniture that you had to purchase for social distancing, I'd say talk to Tiffany about that, because we know that people did have to do some additional purchases around that. But Cindy, I would say reach out to Tiffany with a email so that she can respond to you regarding your question regarding the additional furniture that you had to purchase. Thank you, Scott. Yes, we're very happy that we were able to get the dollars, and we're trying our best to get them as soon as we get the allocation from HHS. And I would say this, everybody thank Office of Head Start and HHS, woo-hoo, because our first allocation was not $11.1 million.
It was around $3 million.
It was about $3 million at first. And so they gave us an additional $8 million to go out to all of you. So the woohoo and the thank you really goes to HHS in support of all of you, because they recognize what all of this cost is that you're incurring out there. So we thank them for this. It is per enrolled child or a slot that you have. If you have Head Start, the number of Head Start children that you have enrolled is how dollars are allocated. And you saw the amounts in the additional slide, and it's also in the CSD update. And the dollars are, again, the PI and the PFA. These dollars are not included in that, but we are doing everything that we can to find and support those additional programs as well. What we're announcing today are the dollars that are federal, that's been allocated across just the federal funding sources. How far back can agencies go to bill for CARES Act funding? Great question, Ken, and I'm going to verify that for you. We know that COVID-19 has been around since January, but I also got one note to remind us that our sites closed in Chicago March of 2020. And so I just need to verify that. So when we send out information, Tiffany will be able to verify that for everyone. Because your COVID-related expenses, when you were already operational under normal services, up until then, COVID-19 shut everything down. In Chicago in March. It shut it down in Seattle earlier than that, for example. But in Chicago, the reminder was that it was March of 2020. And if it can go back any further than that, we will find out to let everyone know and verify that. But right now, we're looking at March until we get additional guidance.
And just so everyone knows, because you're going to be able to read the memo that we sent out, it was in yesterday's CSD update. It does say January 2020 through November 2020. But as Saretho has mentioned, did you have COVID-related expenses in January is the question. Correct. If you did not, and this was not on the horizon for you, then let's not go back that far, you know. And so if these expenses became relevant to you, you know, starting in March, then that's where you need to go ahead and focus.
Absolutely.
And so we can have those discussions. But in terms of the guidance that HHS put out, they were willing to go ahead and go back that far because they understand when the first cases came to the United States. That doesn't necessarily mean that it affected your programs, though, back in January.
Can we send the City of Chicago information that we got specifically regarding the travel ban? Yes, we can send that out, Scott. We'll send it out in an email so that everybody has it. And you're saying, you know, yes, there's, you know, words matter. So we need absolute clarity as our evidence for enforcement, and the evidence for enforcement. I'll send out the guidance that we've received, and then you as the delegate will look at that and see what you need to do with and for your staff. Again, our rationale for bringing it up to you is to remind everyone, as staff are saying they're leaving and going on vacation, we've had some staff already that have had positive IDs in their programs. And what we want to do is mitigate the risk and minimize as much as we possibly can. And so when we have staff that are leaving and are returning to Chicago, we need to know where they've gone, especially now. It's a well worth question to put out there and to let staff know that there is a travel ban in the Chicago area. And if you travel outside of Chicago and you go to these 15 states, that there is a mandate, there is a rule. And that there are some possibilities of fines associated with that. And so we'll get that information out there to you, Scott. Thank you.
And Scott, and just to remind you and everyone else that there is a link within this PowerPoint deck that will take you directly to the emergency travel ban. So once we go ahead and get that out, you can also use this slide deck to go ahead and click on that link. But to make it convenient for everybody, as Saretho has mentioned, we'll go ahead and also put that in the next CSD update as well.
And so many staff, and this is from an agency, Many staff are taking vacation and sick days. Sites having issues identifying subs. What's the possible solution? Can children be regrouped? Children should not be regrouped because then mitigating risk becomes out the window. And so what we've been asking everyone to do is look at your staff within your organization and kind of plan forward, and having those individuals already be a part of the group. So when a person leaves, that other person has already been in that environment. And so you can lessen your risk. But immediately, if you go out and just bring in an unknown person into that group, then you are opening the door for different kinds of things to happen within that environment. And that's why the requirement has been to keep those groups small. And so if there's a sub that's been working between, and coming into that group, and that person can now be the person while somebody goes off on vacation, then you've covered yourself. But trying to move children between other groups, then you end up with multiple groups being impacted, and it's hard to contact trace when you move children between groups and staff between groups. And that's why the recommendation has been that you keep your group static and not add anyone into the mix. What should we do if the parent has gone out of town? Should we allow the child to attend? And I'm going to ask the question of our guide for guidance on that. I'm not the medical person. I don't want to respond. Gwendolyn, thanks for adding that one. We will get guidance and we will share a response to that question regarding the child. If the parent has traveled out, is the question, should the child be allowed to attend? And that will be a question that we'll get an answer for, and we'll come back. So is the requirement in Head Start classrooms 10 or 15 through July 2020? Right now, we're saying 10 in Head Start because that was the guidance that we had as far as keeping the group sizes down. I know recent DCFS guidance noted that you could move to 15 for July. You could move to 15 for July if you've already opened up your program and been successfully operating and have shown to them that you've been able to keep your mitigation and your risk down. What I don't want to do is try to go back and forth and confuse everything. And so what we've been saying is keep the number at 10. Once you know you've gone through those weeks and everything is fine, you can still serve those families remote, which keeps you in contact with those families. Give them a date by which you believe you will go to 15. You bring 5 more in. If there was a classroom of 20, you still have 5 that you're serving remote. Again, it's mitigating risk is what I'm asking everybody to do. And I just want you to think about if you immediately go to 15 and you bring in 5 children, you haven't really, in some cases, really learned how to keep the cleaning done, to keep the movement done, to keep the staffing and everything what you need. This first opening was about learning how to make this work, how to keep your program safe. And that's why we're asking you to minimize your numbers. Do it well, get every system in place and every process in place, and then increase. Okay, the question was related to the placement. It's the same procedure for standalone home visiting. Right now, home visiting is still being done remotely and not being brought into the program. We're not bringing them in. When it comes to placement, as far as children who are home visiting, it's keeping accounting of how many families you're serving, how many hours you're spending with them, what you're doing with them, and being able to account for that. We're going to be looking at and getting guidance on what kinds of things we need to be doing as far as home visiting and when is it safe to do anything other than what you're doing, which is remote. And what's the process when we're looking at home visiting? Again, it's a whole different ball game when we're talking about your home visitors going out into community and actually being in contact with families. And so right now our guidance is keeping those home visits remote. Your staff can come into the site. If your site is ready for them to maintain themselves in your site in the offices, that's fine, but they still should be working with their families remotely. and doing what you can with them outside of your facilities.
And because this has actually came up before about even group socializations, you could still do that in a remote manner. So if your families have the capability to go ahead and do a group socialization, that can happen remotely, then great. If it's a phone, if it's a phone kind of conference call, so those things can still take place when you're trying to keep those social interactions happening.
And so, Sonia, your question is, if we have an existing system for recording and retrieving temperature checks and data, should this still be entered into COPA, or do we need to only enter child temp checks throughout the day in COPA? If you have a system already, as I mentioned earlier, Sonia, some people don't have one, so we're trying to make sure everybody has access to one. And that's why we're working with COPA to put it in the system. If you already have a system, and many of you already do, and that's where you're recording it, and you can pull data, you can use that data to show you what's happening in your program, so you can quickly see how many children in a group may now have a fever. You didn't see that before. It's hard to see that in pieces of paper. That's why we're trying to make sure that there's a data system where you can pull and you can see how many children in a group that you have to be concerned about. If you already have a system, you're welcome to continue to use the system that you're using. But when it comes to you serving children remotely, you will be going into COPA anyway, where you'll have to document for us how many children and that child for that day was served remotely. Right now, you're doing attendance for your current children. This way, you'll be able to do and document that those children are still being served in COPA who are not in your center or in the center-based program. Yes, there is a difference. You will be doing attendance as normal. Eva, the question is the difference for children that are in your center-based program. You're going to be capturing their attendance as you normally would. For the children that are now going to be served remote, what you'll do is you'll click on a tab that'll let you say that child is being served remote, so it still gets captured. And that way that child is still accountable to you, so that we can keep an accounting of the number of children that's being served across all of our programs. And as I said earlier, there's going to be guidance that will come out to show you how to do that. Cindy, the timeline that we started with is when you first opened, it was 8 infants, 10 in groups of 3 to 5, which means that you were not able to go up to your current enrollment in your 3 to 5 groups, and we understood that. The additional children were to be served remotely so that you would still have access to all 20 if you had 20 in a group, only 10 being served in the classroom. The original guidance that we gave was for the first 4 weeks was to serve those children, get everything in place, get your systems down, make sure that you're cleaning, all the enhanced things that you're having to do, that you had enough PPE, that you could do all of these different things for your first 4 weeks. Once you make it successfully through your first 4 weeks, then increase your numbers, successfully bringing in those additional children. Then you're monitoring again to see what changes when you increase this number. Are you getting any new information about the health of children now that you've incorporated another 5 into the group? And so it's keeping an accounting of what's going on as you increase, and taking the time to do that is the best way to mitigate risk, and that's our recommendation to you. The CDC says that shields are not replacements for masks, and that's why I said the word both, because the shield is around the face, and I get that, but sometimes what you have to do is let a child see your face, sometimes just to calm that child down. And having that other barrier has been an assistance for some people. I'm not saying one replace the other. I need you to have both in your program, but I also recognize that a child who needs to be comforted sometimes needs to just be able to see a smile on the face of an individual. And so that those kinds of things can be done. Many people are using the face shield as an enhancement to their program. The other part with the face shield, it also covers the eyes. And so people are using those to minimize risk for their staff. And so they're doing both. And that's what we're asking people to do, is think about what you can do to keep your families and your children safe. Maria's question is about home visits. One for It's the same guidance for home visits. When you're doing home visits, you're following the same guidance. You're looking at the number of hours and the number of contacts that you were making for your home visits. You just wish to do them remotely. And if you have additional questions, Maria, please reach out to me, Saratho, so we can talk it through. But in the cells, it gives you the guidance on what your cadence is supposed to be for the various home visiting programs and the time that's required for each. The question again is, can we use CARES to purchase a few tablets for our remote learners to use to access remote learning? Linda, yes, we're saying that you can purchase technology so that those families can access you remotely. And what we're saying also in the word that Tiffany used earlier, we will say loaners, meaning that you are loaning these to families and they will be bringing them back to you so that you don't lose access to those tablets so that you can keep them over time. And so they would go out on loan to a family, they would come back, another family needs them, you would have access to it so that you can supply that next family. So one of the things that Tiffany talked about, Zuli, in the last meeting, this one she just talked about specifically about CARES Act dollars. What she did not talk about, and she did in the previous meeting, she talked about the quality dollars that you're also getting. So there's two different pockets of money. That $200 that you're talking about is the approximate $200 is coming to you for quality dollars. Those quality dollars are being embedded in your grant. It's not one time. It is increasing your base amount by that allocated amount, and it will be an amount that goes forward. And so you're getting two pots, or actually three. You're getting COLA at 2%. You're getting the quality dollar based on the 200 or so per slot. And then on top of that, what we've talked to you today about is the additional dollars by slot that was on that slide before that you're also getting. And so there's three different pots of money that's coming to each of the federally funded programs. When you're asking about marketing materials, we've talked with our vendor, and I know she's trying to get some information and marketing materials out by the end of July. We'll keep you informed as to whether or not the vendor has been able to get everything done. As you know, everything that needs to be manufactured now, there's a slow pace in getting it. The projection was the end of July. We're hoping that we're still able to do that by the end of July, but we'll keep you informed if it looks like there's any delay. Right now, I haven't heard of a delay, but if we hear of one, we'll let you know. The enrollment dollars that we're looking at, Cindy, is your enrollment numbers that you had when we closed in March. You had an enrollment number that was a static number. Those are still your enrolled numbers as far as we're concerned, unless you drop children in COPA. You had a static number of children that were enrolled and funded in your program, and those are the numbers that we are using for our COVID-19 funding. The question is, should families report when they travel to a hotspot? You want to know if anyone's traveled to a hotspot and they're coming into your program, and that's why we're making sure that you look at the guidance and then you can communicate it to both your staff and parents that they understand what this means if they travel outside of Chicago into one of those 15 states.
I know this may, seem like we're being, invasive when we're asking questions, but now more than ever, it is critical for us to be able to ask our staff and parents where they're traveling. I mean, if somebody's telling you that they're going on vacation, it is your responsibility to keep, all those in your center safe. And so it is not inappropriate to ask the question, and you want to make sure that you're aware. That way they can follow what the rules are. If they need to quarantine when they get back, they need to do that.
And as far as the travel ban, yes, you need to update information and making sure that people understand that you now have a new piece that you're layering on top of this, that there's now a travel ban in Chicago. It wasn't there a month ago, but we now have a travel ban. As I said earlier, things are constantly changing and shifting as we go through COVID-19. We did not know, a month ago that there were going to be 15 states that were going to be hotspots right now, and where we would have to, from our health department, say we are instituting a travel ban, but we have. And so right now what we know is we're asking everyone to be alerted to it, understand what it means, and then communicate out to everybody that there is a travel ban in Chicago and what does that mean for them, and trying to minimize risk. is what we're talking about, is letting everyone know what it means. And please, everyone needs to message it. Everybody needs to understand it. Everyone needs to make sure that they get it. There are 15 states right now that are listed. I'm going to read all of this out loud. Zuli, thank you. With the increased number of infections of children in Texas daycare, we must be able to extend the quarantine to a parent-enrolled children, i.e., if mom goes to South Beach for her 30th birthday weekend, the children have to quarantine also for 14 days. If the mother is infected, it's likely that the children will be infected as well. Thank you, Zuli. I'm glad you said it. I didn't want to say that specifically because we're trying to offer guidance, but you're absolutely correct that when mom travels and mom is the caretaker, then the children are within mom's. And that's why we talk about people who are in contact with someone. Children are in contact with mom. And so we have to carefully moderate that and make sure that the child is now in contact with someone who could possibly be positive. Or just say you allow centers to set their own guidelines. I'm not asking anyone to set their own guidelines. I'm asking everybody to understand that there is a travel ban. You need to make sure all of your parents understand what that travel ban means. All your staff needs to understand what that travel ban means. And everybody, I've had to say it to my staff here, if you travel, you are quarantining for 14 days. Because to minimize risk here, Department of Family and Support Services, you can't travel to California, you can't travel, or to Texas right now and be here with the rest of us, because then you are putting us in jeopardy. And I need everybody to think of it that way. Thanks, Bianca. I'm going to come back to you in just a moment. I see your comment about doing well. Are staff allowed to wear shields without a mask? The guidance we received with the masks were required. Masks are required with the, I said, and I'll say it again, that the shield offers an opportunity if you need to let a child see your mouth, but the teacher should have a mask on with the shield. It is medically approved to have both the face shield and the mask. The face shield provides an additional shield for that staff member who's wearing it, but they also need to have a mask because of the particles from their mouth.
I think that really came into fruition when Cindy had asked her question about
Yes.
the face shields and working with children who are hearing impaired, and perhaps they needed to see your mouth. And what I'm suggesting is, if that's the case, that there are masks out there where you can go ahead and make sure that there is clear across the mask, keeping that open so that that shouldn't be a problem or a barrier when trying to work with your children who need to see mouth movement.
Thanks, Tiffany. We have no updates, I said earlier, we have no updates on increasing to a max of 20 in preschool. The highest number that we have any guidance on is 15. And so we'll, as we get further into the summer, if guidance changes and we're able to go to 20, we will definitely keep you informed. But right now, the highest number we have guidance for is the 15. Can I share information regarding the CPPC where we stated that there is a recompete? Yes, I will share it, and I shared it in our EDPD months ago when I was with you, that because of incidents where we have had incidents in classrooms which have been considered harm to children, as a result of that, that is a non-negotiable effect of a Head Start grant. And as a result of that, we are looking at the city of Chicago having to recompete its grant. We have not gotten notification of it being up yet, but it is something that we're looking at. We have said it to CPPC. I'm saying it to you. I said it months ago, and I'm repeating it again, that when these things occur, that's what occurs and what happens with a Head Start grant. It is our Head Start, Early Head Start base grant that we're looking at recompeting and writing a competitive grant for.
I'm glad you just mentioned the policy council, Sariko, because that kind of leads me into making sure that you guys are communicating effectively with your policy committees. So the funding that's being provided, whether it's CARES funding, whether it's the COLA, the quality improvement dollars that are coming, make sure that you're having those touch points with your policy committee. I know at Policy Council, there's been a lot of interest in what our agencies are going to do with the funding. I'm going to ask that you make sure that you're communicating with your parents, and so they have a full understanding of how those dollars will be utilized within your programs.
Thanks, Tiffany. Betty, yes, Betty is stating that she ordered masks that have the clear front so children can't see the face of the teacher, and you can find them on Amazon. Thank you, Betty, for sharing that. Because those masks, as Tiffany mentioned, they do exist. It is something that is needed for young children to be able to see that and see the face of the individual that's speaking. And then the face shield and that mask provides the kind of shielding that we're talking about needed and desired in classrooms. Children should not be wearing a face shield in replace of a mask. No, the mask is still required. Do we anticipate that we will have finalized bus contracts prior to September 1, 2020? Well, we have our bus companies, but we're not able to transport children because we're not able to get them anywhere that we can, that's open where we can transport children. As soon as we get further along down the line, then we will be talking to you about the transport services that we contracted with so that you'll know who will be able to pick up and transport children from your programs and do your required bus evacuation and pedestrian training. So we've moved forward, but then we have COVID-19 that's kind of stalled us actually getting information out to you. Thank you, Heidi. Heidi is saying that they shared the information at Teddy Bear with their parents and staff about the travel ban, and they're going to continue to do that as they get more updates. They're having conversations with their staff and families around it. Thank you, Heidi. Staff who have self-quarantined for 14 days will still be paid, correct? Also, children who travel will not lose their slots if they have to self-quarantine. Right now, while we still have the funding flexibility, we're able to still pay staff on our federal grants if they travel and they come back and you have to do a self-quarantine. Yes, they're able to still be paid. But we still want to make sure that parents and staff who leave understand what they're doing, and then the agency then has to determine what it will do for those 14 days in operating that classroom while that staff member is being quarantined. That would be if it were a positive COVID test or if it were someone who's traveled. Right now we're saying that yes, you'll be able to still pay that staff, but again, we still need you to make sure that that staff understands what it is that that travel ban and what that travel ban means to you and the risk that they're putting themselves in and also your agency. Thanks, Ken. I don't have an answer for the CCAP question, Ken, right now on children that have to be quarantined. We have guidance on attendance and how they're looking at attendance currently in CCAP. And we're asking for further guidance from our funder for CCAP as well. And we'll know more and have more information when we get more from them. Thanks, Will. Farah, the question is where you have staff who are asking not to wear their mask for 8 hours a day and just to wear a shield. The face shield is not an alone piece. It needs to have a mask, and you've got to work with your staff. And believe me, I understand how difficult it can be, but this is about mitigating risk. And I don't, looking at your program and how you're supporting your teachers, but they need to understand that if they're in the facility for those number of hours and they're in and around other individuals, they have got to protect themselves as they protect others. And wearing the mask is a requirement. The recompete is for our Head Start and our Early Head Start base grant, and it would be for our full funding for our base grant for our Early Head Start and Head Start. Right now, we don't have any notification for recompete for EHS CCP. Megan is asking, do I know what the early learning will look like in CPS? CPS right now has gotten its state guidance on reopening, as all districts have, and they're working to see what their plans will be. I don't have that. CPS will be sharing it once they have been able to make some decisions about how they will reopen Chicago public schools, but no, we don't have that information. Leticia, thank you. El Valor also created a travel policy that reflects the city of Chicago. We will also share with our families this week. Thank you. Could COPA make remote learners present, remote learning instead, or absent remote learning so that we can qualify for CCAP funding? One of the things that we can't do, CCAP is not allowing for CCAP is not allowing for remote learning, and so we can't add that in for CCAP. I apologize, that is not within our policy structure. That is a state decision based on all CCAP grants, and it does not allow for remote learning for CCAP children. I don't have any guidance for travel outside of the country. If there is guidance that is above the state of Illinois that the Washington, D.C. did put out, but right now what we're giving and asking you to keep up with is what is required for as far as bans into Chicago from hotspots throughout the U.S. And right now there were 15 states. So we've got a little bit more time that we have, and we can open up if someone has information that they want to share. I did see in here that there was a comment that things have gone well within a reopening within a program. So if you'd like to respond, if you can put your name in, and we will be able to open up and allow you to talk. So thank you. Just let us know if you have something that you'd like to offer. El Valor has also created, I'm seeing that you know, and I mentioned that a little bit ago, that they've created a travel policy that reflects, and that would be my recommendation for you as well. And so if there are any additional questions, or if anyone would like to open their mic and speak to us about how things are going, we have a little bit of time and we can do that.
And while we're looking for those who would like to go ahead and share out, I just wanted to kind of go back to something that we talked about regarding loaner equipment, laptops, Chromebooks, etc., for families. Making sure that if that's something that your organization is looking to do, that you think about the warranties on those devices, that you're also thinking about the antivirus software on those devices, and that you have a GPS locator on those devices. In addition to, and you know your families, whether they have they may have Wi-Fi capability, but do they actually have the broadband access? And so hotspots may be something that you need to pair with any devices, but that's something for you to decide, you know, locally within your programs if that's needed. But I want you to kind of think about those considerations of warranty, antivirus software, GPS locations, as well as hotspots. Thank you. We're looking to see who wants to share out. I'm sure there's people who are doing amazing things in your programs, and we would love to hear from you. Tom, do you see any hands raised?
Let's see. I see no hands raised. I see Sharon Thompson raised her hand. Zuli raised her hand.
Great.
And
so can we go ahead and start with Sharon? Can you go ahead and unmute Sharon?
yes.
Thank you.
Sharon, if you'd like to speak, you can unmute your microphone by clicking on it.
Lisa, I put my hand down.
Okay, can you hear me now?
Yes, we
Yes.
can.
Oh, thank you. Good morning. Well, we've been open since June 15th. Things have gone really well. And we're doing really well with combining remote learning and in-school learning. We are in touch with our families, and we have Zoom sessions going a few times a week. And we just recently wanted to share with everyone, we recently partnered with Chicago Public Libraries. So we had our first Zoom session with CPL yesterday, and we'll be doing that weekly for the next 5 weeks.
Great. Thanks for sharing that. That's great. That's a great opportunity.
Let's see. Zuli said she put down her hand, so she was sorry.
That's okay. Thank you.
Scott says he just wanted to say we appreciate all the information you have shared this morning. And it looks like Cindy just asked a new question. Do you want me to read it out loud?
Go ahead.
And then I think this question is for people that are on the phone call, because we have over 130 people that joined us today. Can someone share who is open, how their staff is feeling about returning to work?
Anyone can raise their hand, and we'll get your mic open so you can respond, so Cindy can hear how things are going with the staff.
Let's see, I see Tracy just raised her hand, and Maureen.
Okay.
All
And
right.
let me just double check. Leticia,
Yeah. Let's go
Shanda.
ahead
Okay, so I'll just
and unmute Tracy.
Unmute Tracy, and then we'll go through them.
okay. Tracy. And I think, okay, just stand by. All right, Tracy, you're unmuted.
Can you hear me?
We can. Good morning.
Hi. We opened on Monday for children. I want to address the staff. We have had some minor situations, you could say. So with staff, what we wanted to do is we opened up a week earlier for staff to be able to come in, get comfortable with the process of what they have to do when they come in, what's expected of them. You know, even though we had cleaning company come out and clean the classrooms, you know, for teachers, that's their classroom. So no matter how much we think we cleaned it, you know, as a teacher, you want to get in there and clean it the way you feel clean is clean. And so they were able to do that. And then on Monday, when the children came back, the staff were already comfortable. It wasn't like, okay, the kids are here, because, you know, one of the things that we really try to enforce is that if you feel scared or nervous or stressed or upset, the children are going to read off of that. And so they were able to come in and get comfortable back in the routine of coming to work. Even though there was no children, they came in their regular work hours so that they could, you know you got to come like 10 minutes earlier because you may have to stay outside to get in the building, all that kind of stuff. I think the other thing that really reassured staff was the amount of PPE that we had. So, for example, all of the teachers either wear a Mary Crane smock that is here, or we also ordered lab coats because they're longer, and because we wanted the staff to feel like we were trying. Hold on one second. That we were trying to make sure that we made them feel as protected as possible. We let them know they can wear a face mask and a face shield. They can wear gloves. They can wear the lab coat, or they can wear the Mary Queen smocks. We gave them those options, and I think that that's what made them comfortable. They were very excited to see the kids. You know, I've overheard them talking about it's so hard not to just want to hug them, you know, go up to them and hug them, but they got to practice the social distancing. One of the situations, and I'm bringing this up because I feel like this will help. We're all going to deal with different situations. So we had a staff member that had a fever that was over 100.4. But in this particular incident, this staff member has an underlying health condition that causes her fever to go up slightly that way. And so, of course, we did exactly what we said we would do. We would, have them, they wouldn't be able to stay. They contact their doctor. And then the doctor gives us the documentation indicating due to her underlying issue, she's going to have a slight fever at times. And, and this particular person in general is also, she wants to wear gloves. She wants the face mask and the face shield and the lab coat as opposed to the smock that's a little shorter. So I think one of the things with making staff comfortable is just showing them everything that we're trying to do and going above and beyond for their safety as well as we are for the children and families. So, yeah.
Thanks, Tracy.
Mm-hmm.
Tom, I heard you say Maureen.
Yes, let me go. We've gotten a few more hands. Maureen. Maureen, you're unmuted.
Oh, am I? Hi, can you hear me?
Yes, we can. Go ahead.
Oh, okay. It's Maureen Halligan from Miralax St. Vincent. And we reopened last Monday, so we've been open 8 days. And everything that the previous caller said is really, really important. I just wanted to add the additional piece that we were doing as people were working remotely. We did a lot with the mental health issues because we've had a lot of loss. Our staff has had a lot of loss in their relatives and their family. And so we did a lot of mental health kinds of things over Zoom. And then we had them come back for 2 weeks. We had trainings, and we did for every staff, we staggered it, the trainings, but for everybody, we did a trauma-informed training. And it really helped with all the other stuff, with all the other, with the signage and the PPE and everything around, but focusing on a lot of the mental health issues, they really appreciated, and the anxiety. So just wanted to add that.
Thank you. Thanks for sharing that, Maureen.
Okay. We have Leticia raised her hand, see if she'd like to speak. You're unmuted. Leticia? Okay. Another hand I see raised. Scott, I can unmute Scott.
Go ahead.
Scott, you're on your telephone and you have to enter your PIN if you want to talk. So otherwise, you have to enter your PIN on your phone. Click to send the PIN. I sent an audio PIN to you, Scott. If you can enter that in your phone, you should be able to unmute yourself. In the meantime, I'll see if there's any more hands raised. don't see any more hands.
Okay. Well, we'll wait a moment on Scott to see if he's able to do it. Scott, if not, Scott's saying don't worry about it. Okay, thank you, Scott.
Okay.
All right.
See.
Having no other hands raised, Cindy, I'm glad you were able to get some helpful information. That's why we're trying to open it up so that you can share program to program, because you guys are doing the work out there and have information that's definitely worthwhile for everyone to hear. So again, I thank you for spending time with us this morning. We tried to give you information that's helpful. We want to make sure that we have covered information. Again, the next EDPD we have scheduled, we're trying to do them every 2 weeks. So the next one is coming up in the dates and the information. Tiffany wanted to share something with you before we close out for today.
Yeah, so Rachel had started to open up these discussions, and we're super excited to hear from you guys. And I think that this has been a learning experience for us to learn from one another on things that are happening, some best practices that we can kind of pull into the mix. And we've enjoyed it so much. One of the things that we're going to be doing here in Children's Services, and we're so excited, is we're going to be doing what we're calling CSD spotlights on our agencies. And so we're going to start out, and no offense to everyone who's doing great work, but we're going to go ahead and start out with one of our delegate agencies with the first spotlight. And we'll be getting that information out to you guys this week. Within the spotlight information at the bottom, we're going to be asking you if you have stories that you want to share with us, if you have pictures that you would like to send, if you have YouTube links that you want to share out to everyone within our email blast, that we're asking for you to send us that information, because we really do want to go ahead and highlight the wonderful work that you're doing. I have a few stories that we're going to be setting up over the next few weeks, but I really want to encourage you, if I don't have your story, that there's opportunities for you to submit it to me. Mara Martinez, she's going to be my contact in this area, but I wanted to let you guys know that this has been so phenomenal, being able to share with one another, and we want to make sure that we're letting every other delegate agency know the good work that's being done across our delegates, because we've realized that we're learning from one another. So just want to let you know that that's coming. That's going to be in your mailbox. We will not include this information in any of our CSD updates. These will be special edition spotlights that we're putting on our delegate agencies. So thank you guys so much for the wonderful work that you're doing.
Thank you. And thanks for everything that you're doing every day for children and families across Chicago. Just like Cynthia is saying, we miss seeing everyone. This is great to hear voices so that we're not just talking to this computer screen in front of us. But again, thank you for spending time with us. And I know your days are really busy. So thanks again. And we'll be talking soon. There's more information that's going to be shared. Again, check your emails as we're sending more information to you and staying in communication with you. And remember, we're always here in support of each and every one of you. So thanks for everything that you do each and every day. And have a great day. Thank you.